Hi, and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. Subscribe at kevinmd.com/podcast. Today, we have a special sponsored episode from Simpler. We welcome BJ Schaknowski. He is the CEO of Simpler. He is a seasoned software industry executive with more than 25 years of experience in leadership roles across a wide variety of operating functions. A former Marine, he has worked for Vertifor, LexisNexis Software Solutions, CA Technologies, Intuit, and Sage Software. We also have Angel Mena, Chief Medical Officer of Simpler Clinical Communications. In addition to his role at Simpler, Dr. Mena has been a practicing physician in the fields of primary care and hospital medicine for the last 10 years. He also serves as Associate Program Director for Internal Medicine at Cincinnati-based TriHealth. Today, we'll be discussing transforming hospital operations, impacts on clinicians. Find out more at simpler.com. That's sympler.com. The link is also in the show notes. BJ and Angel, welcome to the show.
Thanks, Kevin. Great to be here.
Thank you, Kevin. Appreciate it.
All right. So I'm going to ask each of you just to briefly share your story and journey. So BJ, why don't you go first?
Sure. So first of all, Kevin, really appreciate you spending time with us today. My name is BJ Schaknowski. I've been Simpler CEO for 3 years. And so that's really my time in healthcare. And so compared to so many, people will still pat me on the head and tell me how new I am every day, right? Until you reach kind of that 15, 20-year mark in healthcare, I think they still call you new. But prior to that, I spent my entire career in software. And so the last 10 of which being vertically focused. So really understanding how enterprises, categories, companies can better leverage technology through automation, technology, standardization, data security and privacy, remove manual processes, put high value work back into people. And I've seen meaningful improvements in insurance, in legal. And when the opportunity came to bring that to healthcare, I couldn't say no to the chance. And I've been learning every single day and hopefully adding value to the category.
And Angel, why don't you share your story and journey and how you found yourself at Simpler?
Absolutely. And thank you again for having us. So, in regards to the clinical career, it's a traditional pathway. I went through medical school, international medical graduate, and then came here to the US to train in residency internal medicine about 13 years ago. Stayed on as a faculty, associate program director, now program director of internal medicine residency program. My pathway into technology came just being in the right place at the right time as a startup company was being developed to solve a big problem in healthcare, which was communication. I was invited to participate and consult for the development of the product and the platform. And that's how I end up not just wearing the development hat, but also helping in the marketing side of things and all the other roles at the startup company. And then Simpler, aligned with our mission, with our vision, I joined Simpler, and here we are.
All right. So certainly let's talk more about that. BJ, for those who are unfamiliar, please provide a brief description of Simpler, its mission, and who it serves.
Sure. So Simpler was founded in 2006, and the company has really evolved quite a bit since then. In the last few years, we've really built out a strategy of solving or simplifying non-clinical or administrative healthcare operations for our systems, for our payer organizations, for our non-acute facilities. And really what that means is we've categorized our solutions and we've acquired leading products in 4 areas: provider data management, workforce management, contract and supply chain management, and then compliance, quality, and safety. Our belief is, and this really goes to our mission, if we can help these systems, help these administrators and these clinicians better leverage technology, we can actually give caregivers more time to give care, right? Which is really the fundamental problem we're trying to solve. When we talk to our nurses, when we talk to physicians like Dr. Mena and so many others, the one thing they need back in their day is more time, right? And they find themselves spending too much time on administrative, non-patient focused tasks. The goal of Simpler, right, and who we focus on is really all those workers inside the healthcare system towards that end. I think what makes us a little bit different too is that while most of healthcare tech for years and years and years, and rightly so, has focused on the patient, we focus exclusively on the healthcare worker, clinicians and administrators. And we believe by doing so, it will actually benefit the patients and all other constituents in the healthcare ecosystem.
All right, I'm going to ask both of you the next question. Angel, why don't you go first? What makes you passionate about working in the healthcare technology space?
Well, the passion is the impact that we can make just working from a technology level. I've always say that as physicians, we go into the medical field because, we had a experience in our lives, personal lives, or family that someone was sick, and that kind of turned us into medicine. And we all, the common denominators, we want to change the world. We want to make healthcare better. Now, as a physicians, nurses, and other clinicians, we do it one patient at a time. As an educator, as in my program director role, I do it a group of residents at a time. In the technology world, the impact that we can have is enormous. And that's why I'm really passionate about it. It's working with a team like Simpler's team that we can really make things different for the clinicians and for the patient, for that matter.
Hey, BJ, same question. What makes you passionate about working in the healthcare technology space?
Yeah, maybe a different lens. Everything in health side was obviously, we couldn't agree more, but there is a readiness for technology adoption in healthcare, right? When I entered the space even 3 years ago, everyone told me what a laggard category it was. And healthcare is 10, 20 years behind any other horizontal category, any other industry. And it's going to be an uphill fight, right? CIOs, they can't make system-wide decisions. CEOs aren't going to put the investments. CFOs are going to put the investments in technology modernization. And that's all changed. I think COVID has really been a catalyst. And so I've entered healthcare at a time where it is truly hungry to consume technology to its own benefit. It knows it needs to evolve rapidly, and it's looking for partners that have strong technology backgrounds and understand the acumen, the change management, the interoperability to make it a reality and to provide those tangible outcomes. And how could you not be so incredibly excited about that?
Angel, can you give us an example of how better hospital operations can directly impact both clinicians and patients?
Yeah, absolutely. I mean, I started in the clinical communication world. With a startup company, Halo Health, we developed a clinical communication platform. And the idea was that we wanted to reach the right person at the right time to deliver the right care. And we did that by not just providing a tool, a platform for someone to communicate, but also by understanding how do you find the right person, the right on-call physician. So that was just the start. Now, as we partner with Simpler, acquired by Simpler was able to connect the dots, connect the data in the back, so that now we have the right people in that platform utilizing it to provide care to our patients. And now we're tracking the quality of the care that we're delivering and then connecting back to the communication to our quality and safety metrics and many of the other healthcare solutions that we offer with Simpler.
BJ, I understand that Simpler recently conducted new research in this area. What findings stood out to you the most that you think healthcare leaders should think about?
Yeah, there's one specifically, and really it validated the reason we exist. On average, if you look at administrators, the CIOs, right, the clinicians that we interviewed, on average, they all approximate that about 20%, right, of a clinician's time could be given back for providing care, right? If we actually streamlined and minimized a lot of the technological burden that they're facing today. That's another day in a week. That's 8 hours back. How many more patients could you actually see with 8 hours in a week? We've all seen the data. If a nurse can spend more time with a patient, if a clinician can spend more time with a patient, he or she are more likely to have a better outcome. Right? And so that's what we're doing here. We're trying to give them back almost another full day in their week to provide care, which is why they got into this field in the first place.
And Angel, what were the implications of the findings on physicians and nursing staff? And maybe you could share a story with us to really kind of bring those findings to life.
Absolutely. So I think to follow BJ's comments, I think the survey, in my opinion, underestimates the time that we actually get back when we facilitate the right technology for the right processes and operations. In real life, I always like to tell the story of the ICU time, where myself in training, I had what we all dread the most, which is two codes at the same time, two code blues at the same time, where we have to split the team. And it was because we had a great team in place with great communication that we were able to deliver great care in both scenarios. And that's what's about. 30% of the medical errors that we see in healthcare are because of communication. Okay, and I'm not going to say we're going to solve 30% of the problems, but we're going to facilitate the communication amongst the providers, nurses, and physicians to deliver better care. I still believe that the better operations, we get back more time, we dedicate to communication, we dedicate to better patient care.
You're listening to a special sponsored episode of the podcast by Kevin MD. We're talking to BJ Schaknowski, CEO of Simpler, and Angel Mena, Chief Medical Officer of Simpler Clinical Communications. Today, we're discussing transforming hospital operations, impacts on clinicians. Find out more at simpler.com. That's SYMPLR.com. The link is also in the show notes. BJ, when you think about the challenges hospitals face, what differentiates Simpler as an ideal partner?
Yeah, I think there are three things, and I'll try to be brief, and obviously you can go to significant detail on each of these. The first one is the technology strategy we've put in place, right? Not only did we acquire almost 20 companies, right? We're not just a holder of companies. We are actually integrating all of them into a connected platform that healthcare systems will be able to benefit from. Think common look and feel, think data interoperability, which you can't do today. Think a nurse only having to log into one system and go through his or her workflow without ever know she's leaving one tool, right? So I do think that connected enterprise technology strategy is certainly one. The second one is, for so many years, these systems have not had a technology partner of scale to work with on these operational issues. They've had Epic and Cerner, right? They've had all the big ERP systems, but they haven't had a partner of scale with enterprise capacity and capabilities to work with them as a trusted partner for 5, 10, 15 years to improve this area. And the last one is, and I think this is as important, we bring the change management competency to not only install the technology, which is important, but if they're not getting the benefit from it, who cares? So it's really bringing folks who have done things the same way for 10, 20, 30 years along on the journey so that they actually change and leverage and use the technology that we're putting in place to the benefit of themselves as well as the system. I think that change management piece can't be overlooked, and that's something that Simpler focuses on quite a bit.
Angel, what are ways to ensure that CIO and clinician priorities are aligned to improve healthcare operations and reduce burnout?
I think if you go back to the survey, you'll realize that there's still discrepancies in how CIOs or the technology folks and the clinicians see the problem. Mm-hmm. Most of the clinicians still think that all these technologies just delay the care that we deliver. CIOs and technology folks would still believe that, yes, we still need to consolidate out of a lot of the technology, but the problem is not as bad as the clinicians feel. We need to come to the table together and make sure we're partnering with the right teams that are going to help us, as BJ mentioned, that change management, that partner that's going to help us implement and adopt the technology and make sure that it works moving forward. It doesn't make any sense if we just drop the technology and that's it. So I think that's what we have to do, come together and make sure our objectives are the same.
BJ, based on your discussions with hospital leaders, what are you expecting to see more of in 2024?
Really, the massive tailwind inside of healthcare technology today is system level standardization. Mm-hmm. Right? You can't have a system with 47 facilities operating like 47 different entities, because if you need to move that nurse from one to the other, he or she can't walk in feeling like it's their first day ever there. They need to be able to drop in immediately, same tools, same workflows, same processes, be combat effective. Sorry, prior service Marine, but be combat effective right on minute one. And I think that inertia behind consolidation, picking partners, deploying them system-wide, change management, training, I don't see that going anywhere, particularly given that there's a 40-something% nursing shortage, right? There's a 12% plus physician shortage. There's a shortage in every other area of healthcare workers. You have to get the most out of the people you have. How do you do that? You leverage technology through automation and standardization to see those productivity gains. I think it only accelerates over the next 12 to 24 months.
Angel, what is your advice for hospitals and clinicians who may feel hesitant to embrace new technology?
Well, first, we have to identify the problem. We have to understand what the problem is, and then take the leap and find the partner and find the technology, the platforms that are going to really solve your problems. We cannot boil the ocean in one day. We won't be able to do it, but we need to start working on solutions that are going to solve our problems. And there are real problems in healthcare today that affect clinicians. Burnout is a real thing. I believe in burnout being just trying to get through the day every day. We have to solve that problem. We have to solve the workforce problem. So just take the jump, work with your clinicians, work with your ITs, and commit.
So I'm going to end the interview with just some of your take-home messages that you'll want to leave with the Kevin MD audience. So BJ, why don't you go first?
I think whether you're a healthcare administrator, whether you're a clinician, whether you're a CIO inside of a big system, right? You're at this decision point, right? You are at a fork in the road, and you can't solve new problems that we're all now seeing that COVID really shone the spotlight on by doing things the same way that systems have done them for the last 20 years. And so if I can, as a lifelong technologist, right, seller of technology, installer of technology, provider of technology, be bold and pick a lane, right? And hopefully pick the lane that allows you to use tried and true and trusted, right, methodologies, technology platforms, philosophies to actually get you to a better place. Your patients will thank you because your healthcare workers will thank you. Solve for them with technology. Give them the time to practice at the top of their license. The entire healthcare ecosystem in this country will thank you for it.
And Angel, we'll end with you. Share some take-home messages you would like to leave with the Kevin MD audience.
Yeah, I think I'm going to wear my clinician hat here. We are the connection that the nurses, the physicians, anyone who works at a hospital is a connection to the patients. So we want to raise our voice. We want to come together with our leadership and make sure that we find those gaps in the processes and technologies that we can work together towards, so we can start fixing some of the problems that we see every day.
Well, thank you for listening to a special sponsored episode of the podcast by Kevin MD. We discuss transforming hospital operations, impacts on clinicians. Find out more at sympler.com. That's sympler.com. The link is also in the show notes. BJ and Angel, thank you so much for sharing your perspective and insight, and thanks again for coming on the show.
Thank you, Kevin.
Thank you, Kevin.